A mask mandate right across Queensland. Do we know why that's necessary?
Well, I guess in Brisbane itself, they don't know how many cases may or may not be in the community. So indoors, that makes sense. Whether it's the whole of Queensland, Gladstone, there may have been somebody visiting, so there may be some argument there. But again, how extensive you make these directions and for how long is always a bit arguable. Even the value of a short lockdown. So far in Australia, as far as I can see, in Perth, Adelaide, Melbourne, Brisbane, when they tried it before, and we look at two episodes in Auckland. In none of those episodes has the short lockdown, I think, turned up any other cases that weren't found by good contact tracing, which all those states have. And I look at that in contrast with Melbourne last December, and also in Sydney, where, yes, in Sydney they had the Northern Beaches lockdown, but there were a lot of cases, a lot of unknown community transmission, and that lockdown lasted about 3 weeks. But it didn't lock down a whole city. I think you've got to be careful. You do need more restrictions when you've got some community transmission. You need to restrict numbers in bars, in restaurants, at homes, etc., etc. Keep your distance, all those sorts of things. But whether you need to go to a full lockdown, is that proportionate to the risk? I think that's probably arguable.
Yep.
And the real problem is we've got this problem for another year or even 2 years. So, if we lock down every time we have a case for a few days or a week, I'm not sure that's going to be sustainable, nor do the economic and social costs, I think, the benefits from finding more cases, which so far we haven't, is that really outweigh the costs, the additional costs that are there.
Peter Collignon, we keep on being told that there's no burning platform, there's no rush to get our vaccination program well underway. October is the target for all Australians who want it, to get at least the first jab of AstraZeneca or Pfizer. But we sit here this morning with an unvaccinated nurse at the centre of a cluster. How worried are you about that and our program, given that frontline health workers still are not immune?
Well, I think we do need to get all the healthcare workers who are in contact with patients with respiratory symptoms vaccinated. You've got to remember with the AstraZeneca vaccine, if there's a 3-month delay between the first and second dose, it'll take a while to get everybody reasonably vaccinated. But even when you're vaccinated, you don't have 100% protection against infection. You have very high protection. Some are saying 100%, I'm not quite sure it's going to be that good, against death and serious disease. But even the Pfizer vaccine, which appears better at stopping milder disease, it's still probably only 80% effective. So for at least another year or more, even when you're vaccinated, there's a risk that you can spread the infection. However, the consequences once we have a lot of people vaccinated will be much less, because we've so much decreased the chance of dying or getting into hospital. The most serious rush we've got, I think, isn't for 30 and 40-year-olds. It's for those over the age of 70, frontline workers, be they quarantine workers, be healthcare workers. They need to get vaccinated before winter, because winter is our next big risk period. Because if you look all around the world, and look in Melbourne for that matter, where we've had big outbreaks is during winter, because viruses just spread, or respiratory viruses just spread so much easier. So it really is essential that we get 6 or 7 million people at least vaccinated with the first dose before June, July, and preferably with the second dose. And then we need to do everybody else. But once we've done that, you've got to remember, 80 or 90% of people who die and get, and are really seriously ill are over the age of 70. So we've markedly decreased the risk to society. We haven't made it zero. It's still there. We still have to take precautions, but we can live with a bit of a weight taken off our shoulders, because we've really markedly decreased the chance that people will die or get serious disease.
Do you have any confidence that we'll reach that target? I mean, we've missed every other target.
Well, I think the reason we missed the first target is, 4 million people are vaccinated by the end of this month, is because 3 million doses didn't come out of Europe because they put bans on. Now, you can argue whether they had a bigger need than us because we don't have community transmission of any note. But at the end of the day, that's, the reality. Now we're producing 1 million doses a week from CSL in Melbourne.
Now,
that is quite
doable,
in my view, in the next 3 months
to
vaccinate that many people. We vaccinate 10 to 12 million people every year for influenza over a few months. So, I don't actually think this is anything out of the ordinary.
Well,
to be
are
able
you
to do this.
frustrated, just finally, are you frustrated that our political leaders don't seem to even warming up to having a conversation about how we're going to live with this virus over the years ahead? As you've just pointed out, the vaccine does not stop you from getting it, but what it does is reduce the symptoms like all vaccines do. It's the same as the flu vaccine. So when are our political leaders going to have the conversation about opening the borders and starting to live with COVID in a new COVID normal?
Yeah, I don't think it's just our political leaders. I think they're probably reflecting a lot of people's views in society. I think the problem is we're going to have some COVID normal unless we're going to really live like hermits for the next year or two. At some stage, we're going to have to accept a certain amount of risk that it spreads. But I think we should only do that when we've markedly decreased the chance of widespread deaths or large numbers of deaths or serious infection, which we can do by vaccination and achieve a lot of that, I think, by June, July. But I actually think we won't be looking at normal in any sense of the word till probably October, November, because that's after winter and after we will have a large proportion of adults vaccinated, at least with the first dose.
Okay, Peter Collignon, thanks so much for your time as always.